afternoon, everybody. I'm assuming that there are going to be a few people who will join us. So I'm just going to do a little bit of an introduction, and hopefully everybody that is going to join us will join us before I've quite finished and I can explain the format for today. So it's a bit of a lunch and learn event, so welcome everybody that's joined us. You'll notice that sound and camera has been disabled. This is in order to give us, I suppose, a bit of a bandwidth, but also to be able to focus on the discussion that we're going to have today. It's only for an hour. We've got a couple of speakers who are going to join us, and what we're going to do is, rather than take questions directly, we're going to encourage you to use the chat function to enter your questions in there, and then Shonad and Stephen, who I'll shortly introduce, will be able to pick up those questions. What we're hoping to do is at the end of today answer as many of those questions as possible. Where we don't have the immediate answer, we'll obviously be able to put that into a frequently asked questions and then send that document out to you, as well as keep it on the keep it as a resource on our website. So I ought to introduce myself, it's only polite. For those that don't know me, my name's Ifeoma Onya. I'm the Director of Public Health at Halton Borough Council, and I also lead on research for the CHAMPS Collaborative. We've got a couple of speakers today who'll be joining us, but first of all, I just need to do a little bit of this sort of housekeeping type stuff. So as I've said, cameras are going to be off throughout the presentation, except for the person presenting. Today's meeting is Demystifying Research in Public Health, or I think up there it says Demystifying Public Health Research. It's a workshop which will hopefully answer some of those questions that you have, and also Shonad will be able to give you further details on some of the larger, longer, more detailed courses that are available. The reason why we're running this obviously is because there was the feedback from other sessions that we've run like this suggested that this was a gap in terms of perhaps people's knowledge, and it was something that people really wanted to have. And there's actually a course run by NIHR that goes into further detail. So as I've said, videos will be off, questions in the sidebar. And that way everybody can see that, and you may want to vote questions that you particularly like so that we can prioritize them. And as I say, we have the opportunity, and Shonad will go into this in more detail about where you can find out more information. So I'm going to introduce our two speakers for today. The first of the two is Shonad Burrows. She is a workforce learning and development manager for the CRN in the Northwest. She's worked for NIHR for over 10 years in a variety of roles, including as on a research ethics committee for most of that time. She's worked in R&D in District General Hospital and has worked in university as a research assistant too, and she's covered things as diverse as studies on low fostering uptake, as well as a review of childhood obesity interventions in the West Midlands. So quite a lot of really diverse and interesting experience there. Stephen, for those of you that don't know him, Stephen Peters is a population health workforce development manager working currently with CHAMPS. He's been there since November 2021. He's again got quite a diverse experience all the way through to supporting practitioner development, and has worked in sport and physical activity too. So rather than me steal all the limelight, I'm going to hand you over to the first of our speakers today, Shonad, who's going to take us through a presentation. And as I say before, we do encourage you to put all your questions in the chat bar. Thanks very much and welcome everybody.
Hi everyone, really pleased to see so many of you have logged in. So I'm hoping that means that there's a great appetite for research in the region, and that's quite exciting. So thank you for the introduction there. Yeah, I have been within the research arena for some time now and seen it from several perspectives. So hopefully I can make the whole topic a little bit more understandable and just give you some brief points to think about when you're looking at the possibilities of research and how you could get involved. So let me share my screen and I'll get my presentation up for you. And there we go. Hopefully you can all see that now. So yes, quite a grand title there, Demystifying Public Health Research. Hopefully by the end of this, we will have done something to get along there. The objectives that you will have read about that has brought you along say that I am going to help you reflect on your research skills that you already use in your daily work. Show you how this can be translated into formal research so that we can inform literature and evidence for your sector. Show how academic partners can support the research process and give you some examples of the benefits of engaging in research. So I'm going to do this by starting off with what research actually is, and then giving you some examples of current and previous research in public health. We'll reflect about what it is that you do in your everyday roles and how that can become research, and also give you some pointers on who and what to do to help this happen. Obviously, it's quite a short time, so lots to cover in that. And if there's any questions, we'll hopefully be able to pick them up later. But first of all, I think it's really important to define what we mean by research. And this might sound very obvious because we've all come along, we're all interested in it. We talk about research a lot. We talk about research evidence when you're reading articles and things, but actually, what is the definition of research? And it's not an easy thing to define. The government have a UK policy framework for health and care research within the UK. And this is a guidance on how and what research is. So within that, they have a definition of research, and this is it. So research is defined as the attempt to derive generalizable or transferable new knowledge to answer or refine any relevant questions using scientifically sound methods. And you can see there that I have highlighted a few words, and we'll pick up on these ones because I think this is how we can relate the difference between a service evaluation or an audit to research. And you'll note there that it does come with a couple of definitions there. So for example, what does it mean by generalizable or transferable? And also just acknowledging there that new knowledge doesn't mean that it's a new treatment or intervention or a new way of doing things. It might be that we're already doing something, but we need new knowledge on the outcomes of that, or why one thing works in one area, but it doesn't work in another area. It doesn't mean that the actual thing that you're doing is new. It's the knowledge about it that's new. So it's just our starting point. And as I say, we will come back to that throughout my chat this afternoon. So the great thing about research is that it isn't just, I come from the Clinical Research Network. It isn't just about a clinical intervention. It is all sorts of things that the research can impact. It can impact ultimately the health of our population and outcomes within the population. It could be research on systems and processes. It could be about staff engagement and how to improve it, or how to improve the staff well-being, how to improve how businesses run. It could be how it could inform policies, so government policy or public health policy, and it could inform, or it could make a difference to the economy. If we can find better ways of doing things and more efficient ways of doing things, or help people's behaviours, help people's outcomes, health outcomes, that has a big impact on the economy. So that is already why research is important. But what is it about research? Research compares different approaches to either preventing or treating illnesses or population health problems. And we as professionals, as well as those that use our services, want evidence. They want to know, and we want to know, which interventions work best, which ones are safe, what are cost effective, what are the risks and benefits, because it might be all very well and good that you get great outcomes, but what are the other things that might happen, what other areas will it affect, especially in the complex systems within which we work. And, you know, when we do find something new, is it better than what we've already got? Or is it equivalent to, or, you know, what would be the advantages of this new way of doing things to how things have been done before? So there's lots and lots of things there that, you know, we need evidence on. And in order for us to do our day-to-day jobs, we want to know these things already. So, you know, as a starting point, does that sound familiar? You know, are you already involved in continuous improvement? I'd expect and hope that pretty much all of us here on the call today are always looking at better ways of doing things within our workforce, within our services. What's the best way of doing things? Trying to find better ways, trying to find ways to improve things. So when you do that, do you already look for evidence how to best run your services? And if you are looking for that, if you're looking for evidence on what other people have done before you, so that you can see what might be a good idea and what might be able to go, how do you decide what information you take on to make those decisions? What makes things reliable enough to use? And that's really the crux of what we're thinking about with research. So there is a hierarchy of evidence, which you can see here. And it starts at the bottom level, really, with opinions. So it might be expert opinions or editorials or ideas from people that know what they're talking about. Then on top of that, you might add a bit of evidence where you've got a case report. You know, here's a case of something of us doing it, and this is what happened, or a case series, and that's where you might have 5 people in your service that you followed, because it's a minimum of 5 people for it to be a case series. But within that, there's bias, or there's the risk that you might be leaving out evidence for those people that were least healthy or were least engaged in something. Then you have the ecological studies, and that's just looking at the population style thing, really important. So, for example, in the Altogether Fairer report that the review that you'll all be aware of, you know, we've looked at certain populations and certain areas rather than individuals. So it's looking at what's already out there and big data. And grouping that big data into population size things. Then you could go do cross-sectional surveys. So that's drilling down a little bit into what exists within that population, or case control studies. And that's where you've got, for example, a case where you've introduced an intervention, and then you've going to control it against people in the same service that don't have that same intervention. You have the cohort studies, so you can allocate them to various different cohorts and follow them through. And then you've got your randomized ones, and that's where you take out, you try and control for any biases. So you randomize so that there's no choice in who goes on to one side or the other. And it's very controlled so that you can try and drill down to the actual outcomes of that. And then again, thinking about the Altogether Fairer review, you have systematic reviews and meta-analysis. And this is where you look at all the research in that particular field already, and you look at it with a critical eye. You bring it together to try and find the amalgamation of all the knowledge that there is already. So that's kind of to give you an idea of research and the levels of evidence and data that you might have. But to put that into practicalities, I've got some examples of some public health research that is already going on or has gone on that is funded by the National Institute for Health and Care Research. So at the moment, there is a study called Reflective Fostering. I believe Lancashire and Wirral are both participating in this research study. So it is a interventional study. So this intervention helps the foster carers to do their very best for the children in their care. So it's an extra program to help the foster carers themselves, and then the idea or the theory is that that would help the outcomes of the children in their care and keep people in the service as foster carers for longer, so help them be more engaged. So they have to have a question. So their question is, does offering the foster carers this intervention alongside usual care and support help to improve the emotional well-being, reduce the carer stress and burnout, and have an impact on how often children have to change their placement? So that's the three main questions that they're trying to answer through this. And because it's a randomised controlled trial, an RCT, they're randomly assigning the foster carers to either do this intervention or not doing it, and then following them up to see what the outcomes are, both on the children and on the carers. So that would be your randomised controlled trial. Now, a cohort study, you might have heard of Bourne and Bradford. This one isn't in our region, but it's something that's been going for a long time. So the research, their starting point was why some families stay healthy and other families fall ill. So in order to do this, they have recruited 12,500 families while the mother was pregnant between the years of 2007 and 2011, and they're following them up, and they're still following them up now, right through childhood and the family life. So their follow-up includes surveys, there's measurements, there's biological samples, there's routine data from their health and education records, so that whole big picture. And already they have found some useful information from that, and they're using their findings from that to help decision makers in the city make evidence-based changes. And that, you know, that's moved into a few other cohorts that they're now doing because the data that they've been getting has been so valuable. So an example of a case control study would be the Preston Community Wealth Initiative. So this is about the health and the health inequalities impact of a place-based community wealth initiative, which you might be aware of already. So this one involves a coalition of large employers coordinating action to improve the local economy and attempting to reduce inequalities by changing the procurement so that it's local supply chain, supporting local small enterprises, investing pension funds in affordable housing, improving working conditions, and renovating empty properties for social housing. So this is what they have been doing, and the particular research question involved in this, which I think the University of Liverpool are working with the council on, is has Preston CWI mitigated the impact of COVID-19 pandemic on the outcomes from this? So essentially, this is very simplified with their methods, but the case control comes in by comparing the population of Preston with similarly matched areas who haven't used this model and looking to see what the outcomes are. So that would be a case control where you've got one that's had a particular initiative and you're comparing it with a place that hasn't. So having thought about research and what it is and what the definitions are and the different methodologies there are, a big question there, who can actually be a researcher? So something for you to think about. Do you ever in your day-to-day work, or even actually in services around you, spot patterns in your services? So it might be always a certain group of people attend or that engage or that don't attend, or, you know, they were coming and now they're not. So then you start to speculate, or you make assumptions about what the cause of that pattern is. So that is your actual starting point for research, isn't it? To spot something that's happening and think of a hypothesis of why that might be happening. And then you try something to change it. You go and have a look at the evidence, and if it's there, you know, you might look at that. But if you do these things already, then you already have that mindset for research, because this is where research questions come from. This is looking at your populations, looking to see what is working or isn't working, where the gaps are, what's changed, what might be the things that have changed around that. and then speculating or trying to come up with a hypothesis for it. So I'd imagine that the majority of you already do that. So what else do we need? What are the skills that are needed for research? Well, they're transferable skills, so things that I'm pretty sure you'll all be having your skill set already. Ultimately, it's problem solving, isn't it? It's it's seeing something that needs changing and trying to work out an answer for it and trying to find the evidence to see what answers will work. It's about critical appraisal. It's about taking a critical eye over what's happening and trying to do that, gathering the data, and then again, being critical about it, appraising everything that you've got, trying to not bring any biases in from what you were hoping to find as well. There's a lot of time management involved because there's lots of parts of the project there. You've got to write it up, you've got to assess it, you've got to present it. So lots of skills there that I would expect are already in your skill set. But from what you do already, what then makes the difference? What goes from what you are doing in your services already to actually becoming this definition that the government has of research? Well, going back to the definition and the things that I've highlighted there, we're looking at generalizable or transferable things. So that would be that you're not looking at a service evaluation, so just looking at your service, but actually that you're looking at, would this be applicable to other areas as well? Is what I'm doing, could that be generalizable and transferred to other areas of the service across the region, across the country? The new knowledge, which is making sure that you're not just doing what's already been done, but you're actually gathering new knowledge or refining relevant questions. And I think probably the hardest bit or the thing that we might find the scariest bit maybe is using the scientifically sound methods. But that's something that we can help with. So in practical terms, basically the two main things that you need to do are to review what evidence already exists to ensure that your question is going to create new knowledge, and to plan a sound methodology to answer the question or test your hypothesis, and then follow it stringently so that it can go into that evidence database and other people can pick it up and rely on it and know that the way that you did it, you got the result because of what you've said it is, rather than, there's lots of confounding factors and it could rely on lots of other things. So if we start with that new knowledge, the first thing to do really is a literature search. You might even want to go to the top of the hierarchy that we looked at earlier and do a systematic review. So first of all, is there any evidence already published on your topic? Now, there is a lot of methodology around this, and I'm not going to go into the actual methodology, but just the top line there. So you might find, yes, you've had a look, there is already current evidence on the topic that and previous research that's gone on. So what you could do if you find that the question you have already has research, you could then undertake your systematic review. So to evaluate all the knowledge data to date. That might help you also identify what the knowledge gaps that come out of that, or recommendations or things that need further looking into. You might find, well, that study was interesting, but actually they didn't have enough people on it for it to be statistically sound, or it might not work. They didn't use the same population I have, so it's a similar thing, but it's not the same. So it might help you refine your question. It might help you find gaps. It might help you find a new research question. But what if you did go down the systematic review, you could, we've got a really good website page there on the NIHR about evidence synthesis that has training. It has, you can join as reviewers. It's got all sorts of things on there, but also the NIHR fund some Cochrane reviews. So Cochrane themselves are open to people joining them to undertake reviews. And one of the talks I've had recently was a GP within our network who started out as a trainee, and one of his patients asked him a question and he went to find the answer and he couldn't find the answer. So as a trainee, he thought, you know what, I don't have the time, I don't have the skills, I'm new, I couldn't possibly do this, but he did end up joining the Cochrane reviews and doing a review of the evidence, and then he ended up who incorporated his evidence and guidelines that they wanted to use abroad. So never think you don't have enough experience, or you're too junior, or you don't have the time. It is possible to make a difference on that level. Their website's great. They provide free training in systematic reviews and various ways of doing things. So it's a really good one to look into. But if you do look at the evidence and your research question hasn't, there's been no previous research on it, obviously you can then go, you could take that as your research question and go with that from the start. But the research methodology, that is the side of things that a lot of the workforce might not have got in a lot of detail. We might have touched on it in uni if you've gone down the academic route for qualifications. But it might be something that's a bit rusty or you don't feel very confident about. And that's okay. We've got full-time jobs, we've got things to do. So one of the things that we can do is actually look at a collaboration, joining up with people that do have that expertise and passion for it, and passion for the statistics and the analysis for you. And I'm going to touch on that later, because I think collaboration is key to a lot of getting ahead with research and making it a realization. And also, there's development. You could develop your own skills in research. You could, do a research methodologies course or things like that. But there's other developmental programs that we offer. And again, I'll touch on it in our next point. But also the NIHR have another organisation called the Research Design Service, and they have a branch in the Northwest. And they can help you with your methodology. And their support is tailored to needs of your research team. They work with you face-to-face or telephone or email or video conference, whichever works for you. It's free of charge. And they help you find the type of study that you're doing and match it to particular bids that might be coming in, and give you support on how to write grant application bids to get the money in to afford to be able to do your research. So, again, there's support out there for the research design itself. So who and what else would you need to get involved in research? Ultimately, it's a very hard thing to do individually. Nobody's got the time to do it all themselves. And yep, it costs, to buy the time back, to buy other people's time, to cover the costs that might come in. You could do with a budget in order to do that. So collaborators, take time to network, add expertise to your team. So, for example, as I've said already, it might be that the expertise that you're going to need is somebody that is familiar with all the different methodologies and know how to conduct it and design it, somebody that's done it before. I'd suggest that it's really key to having an expert on your team that has the lived experience of the area that you're looking at, or is a member of the community of the area that you're looking at, so that they can see it from the participant's point of view or the community's point of view, or what's important to that particular population, and help you with the design of it that way. Talk to peers, network with people that have got the same issues or have got a passion for the same things. Work together to produce something together. See if you can get an expert in your team that's good at project management, that's good at the organisation, that can help you manage it that way. So there's many expertise that you might want to network and find that you can add to the potential team for research that you want to work with. And somebody, people to help deliver it. So it might be that you need the people delivering a service on your team. It might be that the people on the ground, or people in some partner organisations, or some of the charities you work with. So, there's all sorts of people out there, depending on what you're looking at, who you might want to include and talk to about it. And yeah, somebody knows how to analyse the findings and write them up for you or with you. might be the same person that's got the methodology when it comes to that. So by doing that, by building yourself people around you with shared interests where you can work together, you're also sharing the workload, because one of the things that stops us and puts a barrier to turning what we do into evidence that can be shared is the time that's involved, that extra time and doing it through a systematic approach with the methodology. It also helps you get a broader viewpoint. I've heard lots of experience where somebody's had an idea, and when they've talked to the population involved or other people working in the field, they've been able to shed a different light on it, and they've been able to refine it and come out with more useful ways of doing it as well. So other things that you could do to find those people: join forums, join groups like this, speciality groups, events, just get out and network. It's a bit of a scary thing for some people, the idea of networking, but it's just connecting with people that have similar passions. And that can really help, and it can really help develop the ideas, even if you don't get them on board with you to help with the workload. It's really good to have those networks out there. But we've got advice on what to do with that. There's a web page on the NIHR's site about collaboration services and support for your research, so you can read up more ideas on that there. Something else you might want to do is consider having students on placement in your services. So especially with masters and PhD students, they need to have dissertations and thesis to do. Is there something that you've got as a project? And if you took a student on placement, could they help you achieve some of that in the time that they're with you? So again, just ways to think about it where you might be able to do that. So the final thing really to touch on is your own developments. So the skills that you might need and how could you take this forward? There are fellowship programs. I've got the website there for you to link to find about some of our fellowship programs. So this is going to take more time and involvement, but it invests in your own personal development as well. So it supports individuals in becoming future leaders in public health research. So there's a pre-doctoral local authority fellowship. There is a doctoral local authority fellowship, and there is the LA Sparks placement, which I know that on our last call, one of the people that undertook that came on and discussed it. So you might want to go back and look at that if you missed the previous call on that. So there's various things that you can do there. There's also we have a free resource for our workforce to go in and find relevant training, all free if you're signing up with a government email address or an academic email address. So do use your work email address if you're going to do this. So there is e-learning. GCP is what we call good clinical practice, and this is what is expected if you're going to be doing interventional research. But as we discussed, not all research is interventional. Quite a lot of what you're doing might be observational, so it's looking at what's happened and then working backwards to see what are the common points that led to that outcome. But if you are doing something interventional, then there's specific training online for that. There's things about fundamentals of research, consent in research, all sorts of things like that. There is a bi-monthly magazine for research delivery workforce that thinks about things such as equality and diversity. We've covered a couple of times how to work cross-organisationally. And there's a part of the website called Delve, and that has a lot of links to outside resources such as webinars and all sorts of personal development. So toolkits, leadership skills, things like that. And finally, there's that funding pot that I said you really need to think about, because it's very difficult to do the research without having the extra time to spend on it and the resources that you're going to need for that. So there's all sorts of bids. Check out the website there. I had a look there. I think there's at least 5 or 6 public health research projects that are looking for people to bid to deliver them. And that changes and comes up regularly as well. So I'd recommend that you look out for that. But you may well get it from many other places. So anything that comes from the research councils, charities, international state funding, government funding, but government funding that is won through competitive process. In the case of if you want to link in with the National Institute for Health Research, we have what is called a portfolio of research, and that has certain tick boxes that need to be met in order for the research to be considered worthy of being on the portfolio. So that's making sure there's enough funding to carry it out. It's making sure that it's been done through a competitive process, because in that way you're reviewing the methodology, and only things that are deemed to be appropriate and of need in the UK would win the funding in the first place, because so it's kind of like a quality control with that. But there's lots of places there, and really what to think about is nurture your research ideas through the 3 C's. So stay curious. What patterns are you seeing? What do you want to investigate? What gaps are there? Have a critical approach, critical appraisal of your professional work, data and things like that, and you can work it up to an approval when the funding call comes along. So if you have a think about being curious and critical, you come up with hypotheses that you can be ready to submit when the right funding bid comes along. But you're not going to be able to do it alone, or you're going to really struggle to do it alone. So the 3rd C, of course, is connected. Who else is doing it? What forums are there? Where do you work? Who can you work with? Once the relevant funding call comes along, and make sure that you're on the list, because if you follow the link in my previous page, then there's you can put yourself on a list to see those funding calls when they come through. There's some supporting information there. There's the School for Public Health Research that has got a lot of good things that I can signpost to. There's our own research strategy. There's your path in research. So again, a few links there for you to look at. So research evidence is important. I would imagine most of you already have the right mindset to do research. I'm pretty sure you're going to have quite a lot of the transferable skills that are needed for research. So it's time to start nurturing those research ideas. Got contacts there for you. And yeah, that's me, open to questions.
Thanks, Sinead. My name's Steve Peters, as if almost said before. I think it's some great information there from Sinead. So what we're going to do now is take your questions. I'm going to pull them off from the chat and read them out to Sinead, and hopefully we'll capture everybody's questions. And if we don't get around to being able to answer them today, then we'll certainly be able to put them into the FAQ document. So let's start off with our first question, and it was from Iforma, and it was around how long does it take to do the review, and is there any help and support that you can get to do that systematic review?
It's a great question, and I've got to say it's not the part of research that we get involved in the clinical research network, so okay. I can't claim to be an expert on that part of it. But the links that I've provided both to the evidence synthesis on the NIHR website and on the lead through to the Cochrane reviews give a lot more information, and they give free training. So you can find out a lot more about it there. It does take time because having done a literature review for for my MSc, it is something that takes a long time to read through, because you've got to find your searches in the first place. Well, you've you've got to think about what your search terms are when you're doing your searches to find the right things in the first place. So it takes a while just to find all of those. Then you need to read them all, to review them, to be able to analyze them. So it is quite a big, or it can be a big thing to do. And it can take quite a bit of time. So, you know, it's not a quick and easy thing to do, put it that way, but it's a very worthwhile thing to do. And it will depend on how much evidence there is to review. If it's something where there's only 3 or 4 studies done on it before, it's going to be a lot quicker than if you're finding something that's had a lot of work done before in it. So getting that search term right in the first place, I think, is really important. But you know, the whole methodology of that is an event in itself. I'm not sure that quite answers the question, because I can't give you a time frame and how long it takes, but hopefully that at least gives an idea of it there. And as I say, it's signposted to people that do know what they're talking about.
Thanks, Shannon. We've got a question from Jane Cook. When it comes to shaping a research question to generate new knowledge, can you share a little bit more about what constitutes new? For example, when analysing the findings of a new local survey, the trends and associations identified might reflect existing research, but that's but the bit that's new is the insight on how things are looking locally. But is that new enough to constitute a research that might be publishable?
Well, that also comes back to the generalizability and the transferability of it. So is it something that is relevant for other services? So if it's new, i.e. you're finding something different to how other people have found, then it is new. So you know, maybe it's the same population, or I say same population, I mean, they've got the same characteristics, but you've come out with a different outcome to somebody else. If you're coming out with the same outcome, but it's just that you've done it in Liverpool rather than in, I don't know, Oxford or Glasgow, then that's not new. If it's something, you know, if there's a different characteristic about that population, or it comes out with a different finding when it seems to be a matched population, then that would be new.
Thanks. Next one's from Martin Mackay. We're looking to do baseline research, skills, knowledge and culture and practice in our local authority to do a gap analysis and prioritise improvement actions. Has anyone got an off-the-shelf tool for this?
Okay, I might need to go back and read that question myself.
Okay.
It might be that somebody else in the group might have that. Okay, so baseline research, skills, knowledge, culture, and practice. I don't think I have, but I'm pretty sure if I ask around, I could find people that have. I mean, we've done it within our own workforce for research delivery skills, but not so much the research skills as in, you know, finding people that have got the methodology, or, you know, what is it that they need. So I don't have a tool per se that we could use, but, you know, that sounds like an interesting thing, and maybe something that people could work on together to make sure that they've got. So it's a good query, but I can't answer that directly. I don't know if anybody else in the room has tried it before.
Thanks. Next, we've got a question from Councillor Lynn Riley. Do you have a view about how quite narrow research streams can capture the wider aspects of life, looking at a symptom or output fails to capture the social determinants of health at a human level? Health inequalities are nuanced combination of many factors and not just a clinical definition. So I suppose that's the challenge of public health research, is that
it is. It's just
it is a little bit different.
A different thing. You know, all of these things are important. You know, it's important to drill down into specific disease areas, but obviously it's a different perspective that needs to inform other aspects of it when you're looking at it in a population area. So I think Narrow work screens can be really useful for certain things, but it does miss the rest of the systems, which is why it's important, you know, when you look at the top end of the evidence synthesis, it's it's having that meta-analysis and being able to take the data from the various different aspects that you've looked at and put it together as a wider review. So yeah, you know, it's systems research is really important as well. And you know, there's various different things, but you need to have a research question to begin with. Even if you're looking at a systems approach, you need to still have something to drill down into to find an answer. You know, there's just so many variables and factors you can look at. It does need to be narrowed down a little bit.
Okay. This one is from Vicky Birch. Could you please explain, we encourage staff within our member organisations working in collaboration with their ARC member lead means?
Sorry, can you repeat that one? Sorry,
yeah,
Stephen.
could you please explain what we encourage staff within our member organisations working in collaboration with their ARC member lead means? And this is taken from the Pitch an Idea to Us section of the NIHR website. Are VCFSs eligible to pitch an idea?
Okay. I think absolutely you're eligible to pitch ideas. For our funding programs, I think you need to be employed by NHS or a government organisation, so a local authority, if for the places on fellowships, but for the funding and for the bids and the pitching of ideas, absolutely, I think it's valuable to get all the opinions and why it's important to have that viewpoint when you're looking at building yourself a research group, to a research collaboration. I'm not sure if that answered the question or not, but
well, if it didn't, we'll pick it up in the FAQs. Then it's another one from Councillor Riley. Oh, sorry, I missed that one. I'll come back to you on that.
And then Claire Selby said that she includes those organisations within their group. So
right.
yeah, the only thing that they don't, you know, where they're not included is on the actual funding of fellowship places. So going for a funding bid, absolutely. Going for our training is a workforce training, so that's yeah, government workforce training really. But yeah, sorry, go on, Stephen. I interrupted you.
There's quite a few people in the chat who are offering support for people interested in research, so definitely
that's great. I've noticed
have a read
that,
through
and that's
chat.
great, and that is why, you know, a group like this is great. Although obviously when I'm doing a webinar, you don't have the opportunity to be talking and networking with each other directly, but there will be opportunities, won't there, with further meetings and the work that you do.
And I think the opportunity with the Cheshire Merseyside Public Health Research Hub, if you're not yet a member of that, please do join that, and we'll put a link into the FAQ document about how you can go about doing that. We've got a question here from Gillian Hutchison, who's been looking at research capacity and baseline skills analysis in the NHS and looking to extend this to the public sector. If anybody's interested in discussing that, please drop me an email so we can do that. Sorry, I'm just trying to pick up the questions from the answers that people are giving.
Yeah, I can see that there's lots of people chatting to each other via the chat as well, which is great. It's a very difficult forum to do this on a webinar, but it's brilliant to see so many people chipping in and supporting each other and answering questions.
So we're sort of coming towards the end of our time. So I think what we'll do is we'll get the rest of the questions done in the FAQ document. So I just wanted to thank you all for attending today. It's been really interesting reading the questions and supporting information that people are giving in the chat. I'd like to thank Sinead for giving her time up to talk to us today. I think research in public health is something there's not enough of. And one of the things, the drivers for the research hub within Cheshire and Merseyside is to grow our sort of research culture in our area. And certainly the research hub aims to support that. And there's a new research facilitator who's starting in the new financial year, who'll be able to support you with that, and further details will be coming out about that once the position is formally announced. But thank you very much for Informa for giving her time to be with us today. And again, thank you to the CHAMP support team who've helped facilitate the website, the webinar today. So without further ado, if you've got any further questions, please keep putting them in the chat. We'll get the FAQ document out as soon as possible, and also the webinar has been recorded and will be available to see on the CHAMP's YouTube channel. We'll make sure all our participants today get that information, and you please feel free to share that with colleagues. And we've had over 100 people join us today on the webinar, which is great. So thank you very much for your time. Enjoy the rest of your lunchtime, and look forward to working with you in the future with the Public Health Research Hub in Cheshire and Merseyside.